For harvest setup, the GID 700 device simply inserts between the liposuction cannula and tube and your waste canister. The input is here with the liposuction tube, and this is connected to the vacuum source. These are the adhesive strips on the bottom of the clear tray. Pull the adhesive strips and simply stick the tray to the sterilized stainless steel base. This base can now be placed either at the foot of the patient or on a sterile Mayo stand. This is connection of the liposuction tube. You can use the supplied yellow elbow or connect the tube directly to the post. This is the connection to the vacuum waste container. When using the connection tube between the GID 700 and the waste container, it's important to use a towel clip to hold the sterile end of the connection tube inside the sterile field so that when you remove the tube from the device, it does not fall out of the sterile field. Connect one end outside the sterile field, connect the other end inside the sterile field to the blue port marked vacuum. Note that the vent cannula, or the vent port, was closed for harvest. This is the tissue going into the device. You can see it filling inside the mesh. You can stir occasionally to assist the water and the fluids leaving. This is the fluid portion leaving the container and going into the waste container. When finished with the procedure, disconnect the vacuum and keep it sterile. Disconnect the liposuction. When filling the canister, look at the volume inside the dashed line here, 100, 175, 250. This is the actual volume of adipose inside the mesh. The fluid portion has been washed out of the device and is now in the waste canister. So the total volume of lipo harvest is the adipose inside this canister plus the volume portion over in the waste canister. Do not exceed the maximum line of 350, 375 milliliters of tissue within the canister. Also note that during the harvest procedure, there is a minimum volume of harvest of about 100 milliliters of tissue. It is difficult to process less than 100 milliliters of tissue, so make sure that the volume harvest is at least 100 milliliters.